From Case Western Reserve University School of Medicine in Cleveland, Ohio, this is the All Access Med School Admissions Podcast. Hello again, everybody. I'm your host, Christian Essman, and I'm the Senior Director of Admissions and Financial Aid here at the medical school. It's great to be with you again, and this is a first for me. This episode is the first time I've had a school come back. Back in the fall, actually, the University of Michigan admissions team reached out to me and said, hey, we have a relatively new admissions dean, Dr. Deborah Berman, and we'd love to come on your show if we could again. I'm like, absolutely, let's set it up. So it took us a few months to kind of get on everybody's schedule, but I wanted to bring you this. They're a wonderful team to work with and good friends. And so I think you're going to enjoy this conversation where we get some updates, some curricular updates and admissions updates. So, hey, let's just kind of dive right into it with Dr. Deborah Berman from the University of Michigan Medical School. Well, Dr. Berman, thank you so much for joining me today. It's great to have you here.
Christian, thank you so much for having me here today. And please call me Deb.
Oh, thank you so much, Deb. I've been excited to sit down with you and talk to you. This is the first time I've had a med school on a second time. We brought you on here because I want to hear what new things are happening at Michigan. But before we get to that, I want to hear a little bit more about you and let's start by talking about your background and in medicine, and then I want to hear then about your role in admissions too and how you got there. So give us the lowdown. Tell us the story.
Okay, well, to make a long story short, and a lot of people say I make a long story long. I'm going to do that. I was born and raised in Los Angeles. I was a gymnast and was actually recruited to Michigan for undergrad to become a student athlete and a gymnast at Michigan. And
Wow.
I came, and what always surprises me for many reasons is I've chosen to stay, and it's been nearly 35 years.
You never left.
I've been at the University of Michigan since I came as an undergrad.
That's amazing. Wow.
It's a really special place to be. So I came and I did my undergrad work, did medical school here at Michigan, and knew that I wanted to pursue a career that really was focused on advocacy and particularly focusing on advocating for pregnant people. So I then stayed on and did an obstetrics and gynecology residency.
Wow.
Fell in love with high-risk obstetrics, which is also known as maternal fetal medicine. I knew that I wanted to become a maternal fetal medicine, but because of my personal life, which I'm glad to share more with you about if you're interested, I joined our faculty for nearly 5 years and then went back and did a 3-year maternal fetal medicine specialist where I focused on taking care of high-risk pregnancies complicated by fetal abnormalities, and in utero fetal surgery and fetal therapy. And then I rejoined the faculty, and that's the long story long.
Wow. How many years of training, if you add all those up, would it be after med school? We talking 11, 12?
Yeah. I did a 4-year obstetrics and gynecology residency.
All right.
And then I joined the faculty for just shy of 5 years. And then I did another 3 years of maternal fetal medicine fellowship. So add that together a lot.
Yeah.
And the right choice for me, because it allowed me to go into a field of medicine that is spectacular. I'm going to own my bias in this space, Christian.
Oh, go. Own it.
I think it's one of the greatest fields of medicine.
Funny thing is, when I meet other physicians who are admissions teams, like radiology is the best thing ever, or emergency medicine, you can't go wrong.
I agree.
Very passionate people about what you do, and it's awesome. That's fantastic. Now, you were telling me before we hit record, something else happened when you were at University of Michigan. You met somebody there.
I did. So as I mentioned, I was a gymnast here, and my first day of college, I met this guy who was also a gymnast. He was from Maryland, and he was on the men's team. And we became good friends. And many years into that friendship, we started to date. And we then got married and started a family. And have raised our family here in the spectacular Ann Arbor, Michigan.
That's amazing.
Yeah.
Wow. What a great story. What a great story. Tell me a little bit, like, why did you choose OBGYN?
So I love that question, Christian. So thank you for asking me that. And I love when you say so many people love their fields of medicine. I have clarity on why I love OBGYN and why I chose it. I think part of it probably started as a gymnast. Gymnastics has really been in the news a lot recently.
Mm-hmm.
And the reality is it was my lived experience, my whole childhood and into college, the good, the bad, and the ugly. And I think it was a sport that required, yes, resilience and grit. It also has required a lot of advocacy for the people in the sport. Mm-hmm. And I knew that early on, and I knew that advocacy for people was important to me. And I think many fields of medicine advocate for their patients. I think in particular, caring for pregnant people really felt like one of the ultimate fields of place where I could advocate for people. So I fell in love with obstetrics and caring for people during that really vulnerable time of their lives. Mm-hmm. And not all pregnancies are uncomplicated. Mm-hmm. Many are complicated, whether from a fetal perspective or the perspective of the pregnant person. So I can marry intricate medicine, embryology, fetal physiology, advocacy for pregnant people every day of my career. And I work with incredible teams to make this happen. The only way obstetrics happens is if you work as a team. Reminiscent to what actually collegiate gymnastics, the only way you launch forward as a team is as a team.
Yeah, right.
Although you're on the balance beam alone, you have a whole team cheering for you. So similarly, in order to do something cohesively in the operating room, for example, a delivery, we need an amazing team. We need the team who cleaned the OR. Environmental services are critical. I was thanking our environmental services team yesterday because the only reason we went into the operating room is they were able to prepare it. And then our nurses and our scrub techs and our students and our learners and our anesthesiologists and OBs and so many more. So for me, it feels like a team sport that cares for people in a really vulnerable time.
That's fantastic. You've been a lifer now in Ann Arbor, I would say. I mean, you've been there 35 years. What do you said it was an amazing town. I think it is too. I've visited there a few times. What are some of the things you do for fun or hobbies that you have there?
Oh, I love Ann Arbor. So I think the first thing I have to highlight are the 4 seasons.
Right.
As I mentioned to you, Christian, I grew up in Los Angeles. I had never seen snow or the change of leaves or really a full spring. It's 60 and sunny. Mm-hmm. I think the 4 seasons are really, really special. And the fun things to do are definitely seasonally based. So fall, if you're on campus, there's endless functions, whether it's sporting events, or as a mecca and an amazing institution, people bring in, whether it's Yo-Yo Ma or all of these incredible cultural experiences. A couple of the deans and I are going to a folk concert this coming weekend.
Cool.
So a lot of things are happening on campus. It is a very green state. So I spent a lot of time outdoors. The hospital is immediately adjacent to the Arboretum, and my house is very close too. So we walk to the Arboretum, which is miles and miles of protected land where our medical students kayak, they raft down, people are fishing, you can be outdoors, you can hike on the trails. And then certainly it's really fun in the summer. Mm-hmm. I think the other thing that's really vibrant in Ann Arbor is it is a city that is mixed with the college. However, it is also just a city. So you have a lot of adjacent areas, whether it's Ypsilanti or Detroit or Flint in Southeast Michigan, where you have this diversity of people who are living together. So it's just a fun, special place to live.
Yeah, sounds great. And going up north, people have never been to Michigan. It is an amazing state. You go up north, like the topography changes, like the vegetation changes. It's a beautiful state.
Yes. I appreciate you mentioning that. For those who are listening, you'll have to get out a map and look. Michigan looks like a mitten with a part on top, which is the Upper Peninsula. And it is all surrounded by Great Lakes.
Yeah.
So currently, a lot of people are talking about with climate change that Michigan is a haven state where people are choosing to come to because of protection from the water and the topography, as you mentioned.
Yeah. Oh, that's amazing. Let me ask you one more question, and I want to dive into the updates or things you want to share we should know about U of M. And sometimes I ask people, like, what's something people are surprised to learn about you? And I think that would be gymnast, that you were a collegiate gymnast. But let me ask you this. What's your superpower? Like, what's something you're really good at, or people that you're known for?
I would say I'm a community builder.
Say more.
People matter and relationships matter. And who you surround yourself with, who you raise up, who you let raise you up, how you grow together, whether it's family, friends, chosen family, work communities, they really matter to me. So I'm definitely known for being a texter, for introducing people, connecting people. And I would bet if you ask friends, family, or colleagues, what's really important to me, it's relationships and building communities, networking for people, and amplifying and sponsoring people so that what was somebody's previous experience doesn't have to be their continued lived experience. You can help people grow. So I would say community building.
I'm hearing that advocacy thing you mentioned earlier.
There you
others.
go.
Yeah, it ties together. Oh, that's very inspirational. All right, let's switch gears here. We want to talk about U of M. What's going on in the curriculum? Any changes that you've been having there recently?
Yes. So for those listening to this, you at this point probably know we have a 1-year preclinical and a 3-year clinical. And I think a couple changes that people should know are, number one, our 1-year preclinical, which is called the scientific trump, is the starting point in your journey for continued learning. And what it looks like at Michigan is it's 6 foundational and organ system-based blocks where normal and abnormal physiology, pathology are presented side by side. What's magical about Michigan? Flexible quizzing. So we have open quizzing schedules. So it opens on Friday, closes all the way Sunday night. So if you say, I want to go to one of those Great Lakes, you can take your quiz on Friday when it opens, and out you go with classmates to go enjoy the Great Lakes or go home and see your family in Detroit or fly to a wedding. If you say, I want to go to a Michigan football game on Saturday and I want to take the quiz Sunday night, flex your quizzing time. Michigan notes that you are adult learners and that one size doesn't fit all. What's really cool is that we have quiz retake or second chance quizzes. So if you take that quiz on Friday and you say, I didn't do as well as I wanted, retake it on Monday. If you took it on Friday or Sunday and you say, I did great, And I know there's a whole nother set of questions available on the Monday quiz. You can retake it on Monday so that you see a new bank of quizzes, you see more material, and we take your best quiz.
Oh, wow.
That first year is pass fail, and it's a true pass fail. So our goals at Michigan in that year are for you to really grow as a learner and learn the material.
Oh, that's wonderful. That's a new thing. I've not heard of that from other med school curricula. I like that. Well done.
I think you then move into the next 3 years, which I love at Michigan. Our second year is called the clinical trunk. It starts with something called TTC, which is transition to clerkship. And it's a month-long program that is really preparing our students to enter the clinical environment, focusing on linking their scientific foundation to clinical skills and patient care, building on interprofessional education you learn that first year, learning how to be a medical student in the clinical space. Mm-hmm. And then you move to your core clerkships, probably similar to most other med schools, to be honest.
The third and fourth year kind of years.
Exactly.
Yeah. Okay.
What is new, I think, for our listeners to know is that beginning 2024, 2025, our students are moving to a new grading system as well. Students will receive honors, high pass grades during those core clerkships, and they're flexible within each grading tier. So that means students will not be graded against their peers. Rather, they're graded on their own performance in relation to specific criteria within each clerkship. So, Christian, if you and I are both students on psychiatry, you and I both can get honors, and not because you and I are being judged against each other, but because you and I both hit the criteria required for honors.
Yeah, so that's great. That's great to know, because then if there's not like, we only give 7 honors of the students who are in psychiatry right now. So, you guys are going to have to figure out how this, but if everybody who's on psychiatry right now gets honors, everybody's earned it. And you know what happens then? Then those really great people in admissions get a pat on the back for bringing in wonderful students who everybody got honors in psychiatry.
Exactly. And I love that. What it allows is students will be able to distinguish themselves for their future residency application process while still focusing on learning the material and collaborating with their classmates. Yeah. Which I think is a big part of the University of Michigan culture, is a culture of collaboration and support. We matriculated these students. We want these students to grow together as future physicians, learn together, because these are the people who you're going to collaborate with nationally as you care for patients and you network and you take care of people.
Yep. And I have to think too, that allowing students to differentiate themselves in this way in the clinical years, like you said, honors, high pass and pass. Also, well, that'll then feed into the residency application piece because we have USMLE, which is now step 1, which is pass fail. So I think some students are asking, well, how can I differentiate myself if I'm passing USMLE step 1? What else am I doing in med school to help differentiate myself? And that's where your process of having honors, pass, high pass, and pass can allow students to do that.
Yes. And I'm going to build on that, Christian. Yeah. Our third year really also helps with differentiation, because our third year, which we call the early branches, it's almost like choose your own adventure. And so people, just prior to starting that third year, they select one of what's called our 4 branches. One of them is diagnostics and therapeutics. One of them is patients and populations. Another one is procedure-based care. And another is systems and hospital-based care. And people can start to do rotations, do research, do a capstone for impact project, select one of over 200 electives, whether online, international, away, that help them build their portfolio and start to really understand what their passion is, how to fulfill that, how to pursue that. So this third year gives you truly, I'm quoting one of our recent students who told me, Dean Berman, it's like choose your own adventure to really help build this portfolio that shows residencies what your passions are, what you're excited with.
Yeah, it sounds like you can really customize. There's probably some things you have to do that are required because there are certain learning objectives that every medical school has to make sure they're training students to do to graduate and for us to be accredited. But it sounds like students are able to tailor or customize through those different trunks what they want to do and highlight for themselves down the road. Correct.
So yes, your third year, you have to do emergency medicine. And between your third and early fourth year, you have to do the 2 ICU month sub-internships. And you can do all of these other electives. And with our remarkable global health program at Michigan, many of our students take advantage of doing international work because there are remarkable, incredible, already established, decades proven programs that are connected with overseas institutions that work on sustainable programming in global outreach.
Sounds amazing. That's great. Let's talk a little bit about one of the common things I've been hearing from applicants, and you probably have too in the last couple of years, is questions to us about self-care or mental health care for medical students. And we shared a couple notes here. I want to hear a little bit more about some of the initiatives you've put in place there.
Thank you for asking that. I want to pause and recognize why I think this is an important topic. When I talk to students who are applying to medical school and I tell them about all the resources we have at the University of Michigan, a couple students have said, wow, does Michigan need more services than other schools? And I say, absolutely not. We have huge rates nationally of burnout, lack of well-being in medicine. It is an epidemic in the field of medicine. So what better time than early in one's medical education to teach people about how to access support and care, what self-care looks like, what getting support and care from an institution looks like. So in 2021, actually driven by a number of our medical students, we reconfigured the University of Michigan mental health program. And it is a premier program where our students have free psychologists and free psychiatrists available to them. As I mentioned to you, Christian, my husband is a psychiatrist in town. I'm well aware of what the waits are for our general population nationally. They're 6-8 months, many places. Our medical students bypass that because we have embedded in our programming therapists and psychiatrists, so they don't have that long wait that our population does. We have a standing unit in the medical school called M-Home, where the entire purpose of M-Home is building community and creating a sense of well-being. So there's a lot of fun events that M-Home does and runs. They also are doing a lot of programming focusing on financial well-being. What do you need to know? Because part of your well-being is not just yoga. It's not just getting together at a football game. It is also understanding the financial constraints and the fact that you should start filing taxes your last year of med school before you're an intern and things like that. So M-Home has a lot of fun activities, a lot of community building activities. They're also running activities that build the well-being for our students in general.
Yeah, it sounds like a great resource center. Yeah.
There's a lot of other support that is provided. Through M-Home, there's actually a peer counseling program where medical students are trained to support. And then we also have the Office of Counseling and Workplace Resilience, OCWR. And it's committed to helping all faculty, staff, house officers, medical students, and their families by providing coordinated, compassionate, and confidential support. So that's important.
Yeah.
And then the last thing I have to mention, because I can't talk about this without talking about this, our student services unit is leading the show with what they provide. I think of our accommodation specialist because more and more students, thankfully, are disclosing their needs. So being able to best support students who have accommodations or students with disabilities needs to be embedded one's curriculum and one's medical school. And it is here at Michigan.
Are you referring to Dr. Lisa Meeks?
Lisa Meeks is certainly.
She is. I hope to get. I'm friends with her. I want to get her. She has a podcast too, and she has disabilities in medicine, and she's a national leader in this, and she is on the faculty at Michigan.
She is. She leads the show with that. I think of Dr. Faranmi Okunlami, who I think everybody needs to look into Dr. O's work on disabusing disability. Dean McKean, Aaron McKean is our Dean of Student Services, who's built up. JT Sangslin is one of our accommodations specialists. So I could go on and on with such pride with these people who are making this a focus for our medical students.
That's outstanding. Is there anything else to share, or is there anything else that you wish future applicants were aware of that they may not find it on your website, or that you wish they knew about?
I think there's a couple things. A lot of people ask me, wait, you're from California, but you went to school in Michigan and you've chosen to stay there. Why? And I think if you think about my career as a fetal surgeon and fetal therapist, I use that as a great example. Fetal therapy program in the state of Michigan. So when I care for patients, I care for this diverse patient population from the entire state, as well as a number of surrounding states who don't have fetal therapy. So you get this diverse patient population relative to demographics, as well as the pathophysiology for the patients that we're caring for. And Michigan really recognizes that not everybody in the state of Michigan or surrounding states have the resources to get to Ann Arbor. So our senior leadership has been really thoughtful about that and has built out our reach through the entire state. So one of my partners is in the Upper Peninsula of Michigan and is the only maternal fetal medicine specialist in the UP. Wow. So patients aren't driving the 11 hours down. She's up there.
Yeah.
And I think that's important for people to know. And when students are thinking about, well, I want to care for a diverse patient population, our medical students are, whether they are caring for patients at Flint, which is 45 minutes north of us, or in Detroit, or here in Ann Arbor, we have federally funded clinics, Packard Health. So you want to care for diverse patients. You want to care for patients where there's significant health inequities, and the need is here, and the resources are there for our students to do that.
Wow, that's exciting.
One other thing that's probably known, but I don't know, so I'll say it. Because the University of Michigan sits on one campus, we have all of these incredible dual degrees that our students can access. So many of our students choose to get an MBA or a master's in public policy or a master's in public health or a master's in social work or even a JD, a law degree, and on and on. And you get to just stay on this one campus. And many of our students who say, I don't want a dual degree, but I want to collaborate with somebody in the School of Public Health, we say, look across the street. It's right there. Let me pick up the phone and make a call for you to make that happen.
Oh, that's cool.
So that's fun being on one campus with all of those resources available.
Right. Oh, that's great. Before I have to let you go, I want to ask you a couple questions about maybe any changes that have been made in the application or the admissions process for your school. In particular, maybe let's start with, have there been any changes in the interviewing process?
There has, And probably, Christian, since the last time you interviewed the University of Michigan, something big happened, the pandemic.
Oh, yeah, I forgot. Oh, that's right. Yeah, it wasn't too long ago.
Yes. So we pivoted, like most institutions did, to virtual interviews. And we've chosen to stay with virtual interviews. And we've been really intentional with that. And I think, number one, it has been shown to eliminate costs for our candidates, from travel to transportation, lodging, meals. There's also some really interesting data in the AAMC that have shown other benefits of staying on a virtual platform. So we're doing interviews virtually with plans at this point to stay as such. We do a really fun interview process, and that is the cohort who's interviewing together that week. They all meet earlier in the week. They get to know each other. We're trying to reduce some of the stress surrounding that, trying to let people know these are the people you're going to go to med school with and become physicians together with. And then on our interview day, we still have a pretty classic day that mirrored our in-person interview. And that was 2 long interviews and 6 shorter interviews. Our faculty, our staff, our alumni, and our medical students interview. We really value that multi-professional input from everyone.
That's fantastic. That's so cool. I like the idea of the cohort interviewing at the beginning of the week. I think that, and then when they come in, they see familiar faces. Like, oh, I met you on Sunday, or whenever your group does that, and you feel comfortable with the people you're sitting around on Zoom with. What about any changes in your admissions, like application process? Any changes there that are worth noting?
So we still have a process where we get your primary application and we are providing secondaries automatically to people who have MCATs above a 35 percentile. And our application reviewers really do a holistic review. The context of a student's journey, where they've come from, where they're going, what is the body of their work. That is all still part of the core mission to the University of Michigan and part of our whole screening process.
Can I ask you, you have a beautiful website. I wanted to tell you that you have a beautiful website, and it's very transparent, I think, to people that might be visiting it as prospective applicants. There's a section in there called the attributes of a successful applicant. How do you, in speaking of evaluation, how do you assess when you're going through evaluation, somebody has achieved that success of a successful applicant?
I love that question. Thank you. I think I would say there's a couple of ways that we do that. Number one, as I mentioned, we have our curriculum set up with that 1-year preclinical, 3-year clinical. We want students to academically thrive here. So taking a look at somebody's academic trajectory is important to us, to know that they're going to arrive here, even with all of our arms around you and hands on your back and support, that you're going to academically thrive.
Yeah.
So does that mean everybody has knocked it out of the park for all of their years of college?
4.0.
No.
No.
We know that people go to college with a lot of growth opportunities and they learn. So we look at trajectories. We also, when you mention the attributes and qualities we're looking for on our website, we really are, and our admissions executive committee talks about this. So what have you done that has shown us your curiosity about caring for humans and the human body? What have you done that has shown us your resilience, your grit, your authenticity about going into a field of medicine, or going into medicine? As I describe, I think it's one of the ultimate jobs of service, caring for other human beings. And no 2 applicants are going to have the same experiences. And then how you write about it.
Bingo.
I want your personal statements, your Michigan secondaries, to speak to your truth. And we don't want a recapitulation of what you did. I can read it in the experience section. I want to know, not from ChatGPT writing it. I want to know from your heart, why did you work at the Humane Society?
Yeah.
What has that provided for you, for the animals, the team you worked with, et cetera? And how are you going to parlay that to a life of service, of caring for other human beings? Or if you're planning to become a physician scientist, how does that all marry? So when your activities and your personal statement don't marry, they don't tell a story, we say, huh. But when they marry and I finish reading them and I'm like, I get you.
Yeah.
And I see your qualities.
Yeah.
And I want you on my team.
Yep.
That's what speaks to me. Everybody always wants to know. And I'll say, that is what speaks to all of us.
Yeah. I am so glad that you said the way you write about things, because that is what I say, because that's the number one question we get from people, isn't it? It's how do I stand out in the application process? I'm like, well, pre-meds, there's kind of a formula, like they have to raise your hand if you shadowed, research, volunteered, tutoring, TA, and a lot of hands go up. There, and this is fine because you're exploring medicine. There's a lot of things that students do to help explore, but then it's the way you write about them that brings them to life. And we get to hear your passions and enthusiasm and the challenges that you faced when you were going through these things. They don't have to be perfect, I don't think, but the ways they challenged you and how you grew from them and how you're still growing. That's where the special sauce is. I'm so glad you said that.
It is. And I want to say to that, we don't have a formula. We don't want to read an application where I'm like, you think I wanted you to do this, so you did this. You quote unquote checked a box. I'm going to say this again. I know I said it twice. Guess what? I'm going to say a third time, Christian.
Say it.
Medicine is about caring for other human beings. It is a life of service. And so what are you doing that helps you learn and grow and understand? And so if somebody has some exposure to medicine already, do I need you to shadow for XYZ hours? I don't. I do consider there's a lot of learning if you've never been exposed to medicine. So yes, go see that this is something that you want to do. But do the things that inspire you and help you grow that body of work to care for human beings. Because every day that I'm at work, I'm caring for human beings. I'm advocating for them. I'm working as a team, whether I'm labor and delivery or in the operating room or in the clinic. Teamwork matters. Communication matters. Authenticity matters.
I have one last question for you, Deb. And that would be, what's a misstep you think you see applicants make that you wish you could help them avoid?
So a misstep that we see is when somebody fills out our secondaries about what they're passionate about, and I look back at their experiences, and there's nothing that marries that at all. We all absolutely have our aspirations. So I had aspirations of becoming an obstetrician. So no, I never had experiences of being an obstetrician. But to say I am deeply committed to X population and not have ever worked with that population, researched that population, studied that population, starting work with that population is, I think, a misstep. As I mentioned with the Humane Society, if your passion has been working to help the pets of Ann Arbor, that is great. So write about that and why that is your springboard to going into medicine, and explain why not veterinary medicine.
Sure.
But to write how committed you are to global health and not have that be part of any of your life experience is hard for us to marry and understand.
Yeah, I see. I'm glad you said that, because sometimes I see something similar. There's not that alignment when people say, I want to help the underserved communities or under-resourced communities, yet there's not any evidence anywhere else in the application there's been some initiative to be in those communities, or like you just said, research or experience or immerse yourself. And while very noble that people want to do that, we're trying to see why.
One thing that makes me think of that I would love to say, this is a marathon. It is not a sprint. This is not about becoming a medical student. This is about becoming a physician. And I want people to know that journeys matter. When you're training for that marathon, you do some sprints, you do some long runs, you do some short runs, and you take some days, weeks, and months off. And we see that. If you look, numbers being numbers, we have close to 10,000 applications a year. This last year, we interviewed 444. We're going to seat a class of around 170. So I know that there are students who applied this year who are not going to matriculate either to Michigan or to other schools, and they're going to reapply. I welcome their reapplications. If they want to become physicians, I encourage their reapplication. And to call us and ask us for feedback of what in their application was something that we noted that they could build on that might help them in the future. Mm-hmm. So not letting that dissuade them on this marathon to becoming a physician. Not everybody's going to matriculate this year. We know that. And you can grow as a human in these growth years between an application and a reapplication.
Mm-hmm, for sure. Well, listen, I think that is a great way to wrap this up. We've kind of told a really very passionate story and wonderful updates about your school. And I think these last few minutes here about your advice to prospective applicants is incredibly helpful. And hopefully they take this away and you know that what you're looking for and what we value. And I think we both would say we value the journey. You have to value the journey of what you're embarking on, not just the next step in that process. So, Dr. Berman, thank you so much for your time today. I'm so grateful that you joined me.
Christian, thank you for having me and for this opportunity. And I have to finish with a big go blue.
Go blue. Thanks a lot. I'll see you around.
Take care.